and welcome to
Good
the
morning.
Suicide Prevention Day event. Hi
Good
there.
morning.
Good morning. My name's John Trong. I'm the Operations Manager at the Barnet Wellbeing Hub, and in a sense, I'll be your host for today. The theme for this year is working together to prevent suicide, and the Barnet Wellbeing Services have worked collaboratively with Public Health, Community Barnet and other partners to bring this event together. I want to share a quick thank you to everyone that has worked really hard to pull all of this together. And also a big thank you for everyone joining us for this to learn more about this important issue and what's going on in Barnet to help everyone. I'm just going to go through a few opening things to make sure that we're all aware of the whole event and how the functions are going to work. So first of all, this is a Zoom platform. And throughout the event, we will be muting everyone to make sure that everyone can focus on the presenters that we have today. Also, with the video, you can turn this off at any time. The other thing I want to mention is that if you do have any issues with connection or bandwidth, you may want to turn the video off as well, as this can often help. Today, we're going to talk about a lot of things around prevention and suicide. And we may find that some of the things that people share are quite distressing or make us really reflect. And so what we have implemented is what we call a calm room or wellbeing breakout room to allow that space for people just to have that moment to gather their thoughts. So if you would like to be moved into that so that you won't be disconnected from the meeting, please message Steph at Community Barnet 1 privately, and she'll be able to move you into one of those rooms. In those rooms will be one of our wellbeing navigators, that's Nahida and also Tom, and you can chat with them privately. And if you have anything you'd like to talk to them about or just want to share, and they can support you. You can also, of course, leave at any time for this meeting, but we hope you're able to stay with us for the full course. The other element we want to talk about is that the event is not being live streamed, but it is being recorded. The recordings will be used internally and will be mainly of the presenters. So no one's video or name will appear in the subsequent materials used. The idea for that is to, for anyone who wasn't able to join us today, they'll still be able to benefit and listen to the presenters talking and sharing about what they're doing. So that's all from me for now. So without further ado, I'd like to invite Dr. Julie George, the new Deputy Director of Public Health Barnet, to open the event.
Thank you very much, John. Hello, everybody. My name's Julie George. I'm the Deputy Director of Public Health for Barnet. I lead on improving the health for adults, and in my portfolio is actually trying to lead work on reducing and preventing suicide, which is why I'm speaking to you and opening the event today. It's fantastic that we have so many people here, but I'm also mindful that a lot of people will have dialed in because their own personal experience, which is also a sobering thought. But as you're probably aware, today is the World Suicide Prevention Awareness Day, 10th of September. It's an international event and is observed every year to attempt to provide worldwide commitment and action to prevent suicides with activities across the world. So we are part of a sort of worldwide movement. Now I'm going to get a little emotional. Death by suicide is a tragedy and can have devastating effect on families, friends, schools, workplaces, and communities. In England, 13 people a day die from suicide. In London, more than 12 people a week take their own life. And in Barnet, we see on average somewhere between 25 and 27 deaths a year. Unfortunately, shockingly, suicide is the most common cause of death for people aged 15 to 24, and the biggest killer of men aged under 49. We have seen since 1981 a reduction in suicide and a downward trend, but in 2018 there was a significant increase. We don't know whether that's continuing. We're waiting for the latest numbers. It's obviously a concern, but the downward trend was the result of coordinated action by the sorts of people that were on the call to try and save friends, family, loved ones. So we know suicide is preventable and it's not inevitable. And the reason we're here today is to actually work together to try and prevent suicide. So today, you'll find out about the good work that's already happening in Barnet to address this issue, what you can do and the difference you can play to make a difference, the part you can play, and how we can work together to actually prevent suicide. There will be an opportunity to have your say about what you think the priorities are in the workshops that we're holding later. So it's really important because this is an opportunity to focus where we think we need to work to actually we want to develop a Barnet-wide suicide prevention strategy. And so it's important for you to have your say. But I'm going to stop there and turn over to the next speaker who will help us take through the rest of the day. But look forward to hearing your views later on when we're running the workshops. Thank you very much. I'll turn over to Sahir. Thanks.
Thank you, Julie. Can everyone hear me? Could somebody just, John, can you just thumbs up? Good, thank you. My name is Sahir Kayekci. I'm Senior Public Health Strategist in the Barnet Council, in the Public Health team. And I know many of you, last year we had a fantastic event in the World Mental Health Day. So gaining the momentum from that, we want to continue building up our action on suicide prevention. And I'm going to, Julie talked about some of the suicide figures, but I'd like to just focus on a little bit more Barnet in comparison to England. If you move to the next slide, please. Thank you. You could see that the black line represents England and the green line represents Barnet. Barnet's rate, if you could see, it started to go down. And currently, we have significantly lower suicide rates in comparison to England. And between 2017 and 2019, there were a total of 66 suicides in Barnet. This is the 5th lowest in London. I just want you to note that these figures are for deaths registered rather than deaths occurring each year. Because of the length of time it takes to complete a coroner's inquest, it can take months or even years for suicide to be registered. So they are the number of deaths registered in Barnet and in the UK. Although the suicide rate has been higher for the men than women in the borough, it actually has decreased significantly since 2016. So these are all kind of good news for Barnet. And what are we doing in Barnet to prevent death from suicide? Next slide, please. So we have, as I said last year in my presentation, we have a multi-agency suicide prevention partnership. Whilst an important aspect of suicide prevention is managing mental health conditions, but many people who die by suicide are not known to mental health services and have not visited their GP recently. So in addition to clinical services, it is important to have a whole system approach to preventing suicide. And our partnership is reflecting on that. It brings partners together from NHS, from social care, adult social care, children and families, safeguarding, voluntary and community sector, London Metropolitan Police, British Transport Police, and most importantly, we have our friends, people who have lived experience, are actually helping shape our action going forward. And we have actually many of the colleagues in the partnership are actually presenting here today. So we have two major aims. Obviously, we want to reduce number of people who die by suicide in Barnet, and we want to provide better support for those bereaved and or affected by suicide. Suicide prevention is also a priority for North Central London sector. We work across 5 North London boroughs, joining our forces together. And we were very successful in bringing some money to the sector. And then we have procured support after suicide service. Rethink mental illness. We're very privileged to have Katie Falser here today. She will talk about this service later on. Also working with Rethink, we have put in place suicide prevention and bereavement helpline during the lockdown. And some callers, some callers mentioned that if they had not made contact with this helpline, they would have attempted suicide or would have self-harm to a greater extent. So we were right to put in this place, this helpline during the COVID. And we also commissioned COVID-19 bereavement support and counselling service. Again, colleagues from Mind in Barnet and Community Barnet will talk about that later on. We are working with London colleagues and we're part of Thrive London Suicide Prevention Information Sharing Hub. This will provide us access to real-time data rather than a backdated data, if you like. And having access to this data will contribute immensely to our plannings going forward. We will understand what's happening in the borough much, much better. We have training programs for primary care and all the frontline staff in the borough, faith-based charities, schools, colleges. We have plans to provide a lot more training on suicide prevention. We have digital supports in place. And if we go to the next slide, I just want to invite you to consider this. What can you do individually? If you have 20 minutes, please go and do Zero Suicide Alliance suicide prevention training. This will help you this will enable you to identify someone who is presenting with suicidal thoughts or suicidal behavior, and it will give you confidence how to approach them in a very supportive manner, and it will give you information about how to signpost these individuals to services. If you're going to take one thing from today, please go and do this training. It is brilliant. You can save life anywhere here in London or somewhere in the country, somewhere outside of the country. So this is all from me. Thank you very much. The next speaker is Sarah Perrin. She's Head of Mental Health and Dementia Commissioner, and she's commissioning these services on behalf of both North Central London and also London Borough Barnet. Thank you.
Thanks, Sahir. Hi everybody. So as Sahir said, I'm Sarah Perrin and I'm Head of Commissioning for Mental Health and Dementia. And I was asked today to talk a bit about improving mental health services, but also about raising awareness and prevention. So just as a starter, I really want to pause about the fact that we all have mental health, and we have good mental health days and we have bad mental health days. And it's really important that we recognise that mental health is just as important to us as our physical health, and both are tied together. And at least 1 in 4 of us are going to experience a mental health problem at some point each year. At least 1 of 6 of us are going to experience some kind of anxiety or depression each week within the UK. It's important to realise that suicidal thoughts and self-harm, they are not formal mental health diagnoses, but they are related to our mental health. And Mind reported that over the course of someone's lifetime, 1 in 5 people have suicidal thoughts, 1 in 14 people will self-harm, and 1 in 15 people will actually try and take their own lives. So mental health is all of our responsibilities, and it's really vital that we understand what resources and tools are out there to look after our own mental well-being, but also to recognise how we can give people good information and advice about what support's there for them. And when we think about prevention, that's a really, really key part of it, is really knowing what's available in our communities. And I also just wanted to reference that, particularly in light of COVID-19, this has had a real detrimental impact on some people's mental well-being through social isolation or loneliness, but also wider economic factors, jobs, etc., and the worry and stress. So it's just really, really important that we're aware of what we can use to look after ourselves. And just to echo that, from the CCG and the local authorities' perspective, we are absolutely committed to working together. And we are committed to working with our communities and with other key stakeholders to really try and support that there are no suicides occurring, both nationally but also within Barnet. So on that note, I wanted to talk a little bit about mental health crisis, because when people take their own lives, they're usually having a mental health crisis at the time, they're feeling overwhelmed. And it's really important to understand that mental health crises has lots of kind of definitions and ways of regarding it. So it's a situation that a person's experiencing, or anyone's experiencing, where they require immediate support and assistance and care from urgent and emergency mental health services or from others. There's often many possible causes or triggers of what's caused a crisis in someone's life. For example, it could be an adverse life event, it could be something physical or social that's happened. And again, it's about that urgent response and making sure they've got the right tools to them. And all crises will be different in their cause, presentation and progression. And people that are in crisis can be anywhere. They can be in their community, they could be in an acute setting, or they could be in a criminal justice setting, but they could be absolutely anywhere. It can affect people at any time. So within Barnet, in terms of our mental health services, we've got a huge range of support that's there to help people maintain and maximise their health and well-being. So we have the Barnet Wellbeing Service, who, as you know, are kindly hosting this event for us today, who hold a whole array of kind of support for people, including emotional health checks, activities and connecting people. We have talking therapies in Barnet, so we have improving access to psychological therapies delivered by Barnet Enfield and Haringey Mental Health Trust, Barnet Refugee Service and Mind in Barnet. We have support via secondary mental health services. So we have Barnet Enfield and Haringey Mental Health Trust delivering that support. And that support is very far reaching and ranging from community mental health teams, psychology support, psychosis support, wellbeing support, and also crisis care support, including crisis resolution home treatment teams and mental health liaison services based in our hospital. In terms of the crisis pathway, there's sort of 4 distinct areas that we can look at that are really important to get right for someone. So that's access to support before you're in crisis. That's really, really key. That's your prevention, but prevention runs throughout the pathway. So it needs to be really accessible, 24 hours a day available, 7 days a week. People need urgent and emergency access to crisis care if they need it, when they need it. There needs to be really good quality treatment and care and support. And also you need to ensure that you're promoting people's recovery and preventing future crises. So important to note that NHS England last year published the long-term plan, and in there were some very clear priorities to be achieved for mental health. And within it, the NHS set out a commitment that they were going to put significant investment into mental health services, recognising that there hasn't been the level of investment required, and also really building on the commitments of the 5-year forward view for mental health. And so some of the key bits that the long-term plan committed to in terms of improvements were around expanding access to improving access to psychological therapies, making sure there were new models of care and support for community mental health services that are wrapped around primary care properly, it's holistic, it's integrated with our voluntary community sector offer, etc. That for people that are experiencing mental health crisis, services are expanded there, meaning that there's 24/7 access to crisis support for everyone nationally. And that would include crisis alternatives and also 24/7 psych liaison services in acute sites. Additionally, the NHS committed that they were going to do work to make sure that 111 was linked properly with mental health crisis services and working well together. and make sure that everyone understood what the support offer was if people presented in crisis. Additionally, it went further and talked about post-crisis support for families and bereavement, support for people affected by suicide, that ambulance staff would be trained and equipped to respond effectively to people in crisis, and also about increasing access to specialist perinatal support for families, that those that did need inpatient care would be kept within their own communities rather than inappropriate out-of-area placements, which is a really important part of recovery and self-management, that reducing suicide remains a priority for the NHS, and that good multi-agency working was key to this, and also that a new mental health safety improvement programme would be developed with an absolute focus on suicide prevention, including ensuring the bereavement support was there for people. So I wanted to talk a little bit about what improvements have already begun, have either already happened in Barnet or are in progress and still happening, and will take time to achieve, but we're on the road to. So firstly, we've got a great commission prevention offer in Barnet. We're really, really lucky, and really important to note that we've also got a really vibrant and diverse voluntary community sector, also comprising of lots of non-commissioned providers. We've got over 1,000 VCS in Barnet. We have a really good digital offer in terms of support. We continually work across the local authority and the CCG to raise awareness of mental health support and suicide. So this day is obviously a day we celebrate every year in Barnet in terms of really trying to raise awareness of suicide prevention, but also we have Mental Health Awareness Week and other key weeks throughout the year where we really try and promote the support that's there. We have a suicide prevention multi-agency forum led by Public Health, which is made up of key partners across the system. In 2019-20, we've put significant additional investment in Barnet into our improving access to psychological therapies offer to really make sure it had the right capacity to meet people's needs. And we also worked with Mind in Barnet so that they could offer improving access to psychological therapies. In 2019, so last year, we also established individual placement support within our secondary mental health services. And we'd had this previously, but it left sort of the borough and it's back in the borough again now. And that's really important when we think about socioeconomic wellbeing and employment support. It's all linked in one, it's about holistic offer. We already had a 24/7 crisis line in Barnet, but due to the COVID impact, that is actually now an all-age 24/7 crisis line, which is actually a really, really good move forward in mental health services. We have an NCL-wide specialist perinatal service, and we are enhancing and expanding that service year on year with commitment to increased funding to deliver targets and make sure that people have that support. We also, in autumn of last year, successfully bid for some additional funding to support developing crisis alternatives in NCL. And so that work is underway, looking at trying to have either a crisis cafe in Barnet or a safe haven. And that work has been paused because of COVID, but we are looking to try and re-establish that and get that off the ground again. We already had 24/7 psychiatric liaison within our hospitals, so that people presented in distress in our emergency departments, they had trained professionals to work with them and try and support them. And we will be continuing to expand that offer to try and make sure that it moves towards Core 24 standards, which is a model for psych liaison, which is best practice. We are working on developing our new community framework across NCL for our community mental health teams, as I say, really wrapping them around primary care networks and integrating them into our voluntary community sector offer. We're also looking at trying to develop an NCL-wide autism and ADHD service. And again, that work has been put on hold because of COVID. It started in January and it's been completely put on hold, but we are actually starting that again now. We are working to improve and transform our support for children and young people experiencing mental health, where we know that there is a lot that could be done better. So we have a transformation programme for our child adolescent mental health services. We're looking at improving transition support as well and doing better joint working across both adults and children's and whole life commissioning We've put into place an assertive outreach offer for children and young people with mental health distress. And also we've improved support and in-reach into schools, working closely with family services on that programme. As Sahir said, across MCL Public Health have commissioned support after suicide service, and that will be going live in October. Our crisis resolution teams are also being expanded to try and make sure that they can provide a more holistic offer of home treatment to people in crisis in their own homes. And the Mental Health Trust is also doing work to transform their recovery house at the moment in Barnet to make sure that people who need more intensive support in crisis can have it without being admitted into an inpatient setting, and also really ensuring that's a holistic offer. And also, as both Julie and Sahir said, we're developing a new suicide prevention strategy. So with that in mind, I wanted to say that we are aware that there continues to be lots to be done to improve mental health services, but also really encourage everyone to find out about the wide array of support that's available around us to look after our own mental well-being and also others. And as Sahir says, encourage people to please do the Suicide Alliance training, because that's really, really important in terms of being able to spot signs of when someone might be feeling very, very distressed, in crisis, etc. And with that, I'm going to now pass it over to Tanya Slessor, who's going to talk to us about her lived experience of being bereaved due to suicide. Thank you very much.
I've spoken about my story so publicly, so forgive me if my voice gets a little bit crackly. Grief affects people differently, and nobody can understand how you feel, and nor can they understand your grief. And when the traumatic loss is suicide, you're left asking so many questions, and the only person who can answer them is no longer here. I will never forget the phone call I received nearly 2 years ago to say that Marty had died. The words will stick with me forever. I was on my way to a meeting when my best friend, who is also his cousin, called me. I remember trying to process what she had told me. The feeling of disbelief, the anger, the sadness, the guilt, the pain was immense. I remember putting the phone down, and I don't know if it was shock, but I continued to my meeting. Then I started to travel home. I don't remember the 40-minute drive home, but my grief journey started the minute I collapsed into my friend's arms. You see, we'd separated a few months prior. A few days before he died, I'd been contacted by his family asking if I'd seen him, as he had been missing. The thoughts that entered my mind were never ones of him taking his life. I never believed he would do it. I changed my phone a few weeks before, but not activated the old number. Whilst I was with my friend that day, she initiated this, and a few hours later in the inbox was a text which read, "I love you. I'm sorry I didn't listen. You're not to blame. Find yourself and become the fun-loving person you once were." The weeks and months that followed are a blur. As well as grief and pain, I was navigating life, talking to the coroners, the police, family, friends, trying to find those missing pieces of the jigsaw puzzle. Everything was black and white in my life. I needed people to be gentle with me. That wasn't always possible. What followed after his passing was judgmental views, especially at work. I realised suicide was still taboo. I was told not to talk about him or suicide because it caused others discomfort. It made my grief feel invisible. It was a reality check. Society not talking about mental health and suicide was contributing to rising suicide rates. Suicide is the bigger killer of both males and females under 35, and the single biggest killer of men under 45 in the UK, and yet people still feel unable to speak openly about it. On reflection, I could see the trigger. This was confirmed in the inquest 4 months later. 2 years before, he was involved in a cycling accident. He had suffered a head injury. He progressively got worse. He wasn't sleeping, which impacted on his work. I thought this was the reason why he would get frustrated and get angry over the smallest of things. And at the time, I didn't understand. We'd known each other since we were 11, but towards the end of our relationship, it seemed as though I was with a complete stranger who distanced himself, pushing me away until we separated. I'd lost him several times during our relationship. It was a roller coaster. I was trying to keep things together when I felt everything was falling apart. He was reluctant to speak about his feelings and refused to talk to his GP or any other organisation. Even though I seemed fine, within 6 months of losing him, I'd lost friends where I was blamed. My probation at work was extended, reasons related to my bereavement. I had a car accident. I was treated for abnormal cells in my cervix. I thought I was really strong, but now my friends have since told me how fragile I actually was, and I'm so grateful that they were in my life. I took time out of work, which helped me to meet grief head on. What I've been through is immense. There's no denying that. Sometimes I look back and I wonder how I survived it all. I'm not the same person I was. I'm still independent and resilient, but something has changed in me. My moments of weakness has made me stronger than ever, if that's even possible. There are a few things that helped me through those dark times, which I'd like to share with you, and also offer some advice if anyone shares with you that they have been bereaved by suicide. I was lucky to have the love and support from my family and friends, but please don't assume that someone is getting the support. Suicide can cause divisions within a family and a friendship circle. Show the bereaved kindness. They're trying to piece together what has happened. Being there to listen, acknowledge the loss, not to offer solutions or what you think are small comforts. At least you didn't find him. These sort of things can cause more harm. My friends would walk the dog with me. Sometimes we'd walk in silence, and some days we would talk about Marty, and sometimes we just spoke about everyday life and randomness. Be patient, allow space and time. If someone doesn't get back to you, don't take it personally. It can feel really overwhelming sometimes. Try and make a pre-agreement. The person doesn't need to feel any more guilt on receiving a message from their friend that says, I haven't heard from you in a while. Why are you not answering me? I've learned to ask for help. Offering help to someone with their daily life or helping them with navigating the calls is much appreciated. It's not time to be the office gossip. The person bereaved by suicide will definitely not want someone shouting across the reception area in front of people, so what did you do to make him jump? Show sensitivity and compassion to the person bereaved and to those that are around you. You don't know who's in that reception area who may have experienced their own mental health difficulties or been bereaved by suicide. The common phrase committed suicide dates back to when suicide was a crime. The phrase is still commonly used today. Try using took their own life or lost their life to suicide. Please be kind and think about the language that you use. It is okay to politely challenge stigmatising language and attitudes around suicide and mental health. This can be the start of making a difference. I'm grateful to have been given this opportunity to contribute to today's event on suicide prevention. I hope my story will encourage others to find the strength to come forward and source support, and for others to make a difference. I've seen the progress being made with the commissioners and the local authority who are listening and making positive changes across the borough, and how collaboratively services and the community are working together to ensure people are able to connect to the correct services to access the support. Thank you.
Thank you, Tanya. We're really pleased that you've been willing to share your story with us. And unfortunately, we know you're not alone in your experience. It happens too often. You managed to find your strength to come forward, and we hope that this will encourage more people to do the same as well. Importantly, it has to be when you are ready to share. But it's really important to share what we are going through, to actually talk to someone. We know, I think, for the whole community, we can do more. It's only in this way that we can work together to improve the support in the community and to the families. We are taking a step forwards towards that in the last few years, as you've mentioned, and Sarah and Julie and Sarah have also shared that there's more of a shift towards more collaborative working in prevention. And hopefully with that, that's the only way we can help support more people who have been bereaved by suicide. With that, I would like to introduce the next speakers, who is Karen Morell, from Head of Mental Health Services and Adults and Health at a local authority, and also Michelle Moraes, who's one of the enablement managers at the network. So we've actually worked together very closely with the network. We have a meeting which I'll talk about, is around more complex cases of any suicide or risk that's involved with that. And that collaborative work is one step in terms of the prevention. So I'd like to hand over to them to talk about the collaborative enablement approach and a wellness checklist.
Hi everyone. As John said, I'm Karen Morell, Head of Mental Health Services for the London Borough of Barnet. I'm also a yoga teacher as well, and I'm a mom. of a 22-year-old that has gone through some mental health issues herself. But thank you very much for inviting us to talk today. Michelle and I are going to talk about how you can work with the individual that feels suicidal, and I've been asked to just introduce that work. I mean, one of the things for me is that it is really important that we take a person-centered approach when we're supporting and working alongside an individual that feels suicidal. What do we mean by that? So, well, we need to understand the person, we need to understand the risk that the person is presented. We need to understand the drivers and to work together with the person. It's no good us coming up with solutions without working alongside and understanding what the person is feeling and what might support that person. So the connection with the person, their family, etc., is really important. And we need to also understand some of the strengths that the individual may have, and the strengths that we can actually help them to identify and support them to get through a real crisis. And what we want to do as a support service is to encourage them to look at their coping skills and support the person to adapt to changes. And that sounds easy, and I don't want it to sound easy. I know that that's a real complex thing, and when the person who's feeling suicidal and feeling the way they are, then, you know, there has to be some patience and understanding. And we need to understand what the person's life changes might have been. So many people that we work with say that there have been changes in their lives that have made them feel the way they feel. And maybe that's emotional changes, relationship changes, economical, homelessness, housing issues that might have impacted on their emotional and their mental health, with their mental health. And for me, it's really important that we remember we're working with an individual. We're not working with a diagnosis. We're not working with the label. We're working with an individual to understand that person. And for me, when I work with people with mental health issues, I always have this mantra in my head that we're working with an individual that has a past, a present, and a future. And I think that's important for us to acknowledge. You need to identify the support with the person, not on your own, because the person, you know, will sometimes know what support they need, or other times might not know what support they need. So you need to identify the support that's both formal and informal. And there may be some support that they've never thought of that actually might be helpful to get them through the crisis that they're feeling. And I think what we need to do is we need to help the person to feel hopeful for the future. And I'd like to think that there is a hope, and hopefully we can make a difference if we work with the individual. I'm going to pass you over to Michelle now, who's going to share some stories of the way that the service have worked with individuals that have felt suicidal. So Michelle, I'll pass over to you now.
Thank you, Karen. Okay, so at the network in particular, we have received during COVID-19 a huge amount of clients who have presented with suicidality and have been incredibly distressed. I would say there's been an escalation of distress and anxiety that has had certain themes which have linked up with the lockdown and more restrictions and more isolations. So I spoke to my team today and over the last few days to get some examples of the way we've worked and to start identifying what the commonalities are and what the responses are that have been most sort of effective to reducing risk and working collaboratively with our clients. So I'm going to talk about 3 very brief cases, and then I'm going to read you a vignette from one of our social workers, which I think encapsulates very much the position that we take at the network when we're working with people who are distressed and potentially suicidal. So the first case I wanted to share with you is a client who called a few weeks ago very much in distress. And they were crying and saying that they didn't want to live because what they were managing was that an alleged perpetrator had been able to walk free. and the people were unable to locate the individual who had caused our client, the victim, had been unable to locate the perpetrator, and what had happened as a result was our client had a relapse in her mental health. So the call was received by one of our staff, and it was after hours. And what we noticed, or what she noticed, was that the person was incredibly hysterical at the beginning of the call, and was feeling very, very uncontained and very unheld with the news that she had just received. So the first thing that I think helped was just listening and giving her some space to actually almost get to a place where there was a reduction in her sort of emotional outpouring and expression, and a stabilization. And then what we did, or what the worker did, was to help her to start thinking about her emotions around this. So what she identified, which was actually, I think, quite off the normal range of solutions that you might come out with, was what was by asking this woman what helped her. The lady actually said singing and painting. So they actually began the process of stabilizing her by singing a little bit together. And when Karen talks about sort of being very person-centered, I thought that was a brilliant example of what works for individuals, and actually going with that as a clinician. After that, she went through, obviously, the risk management, the suicide, the safety planning, thinking about what this person needed to do, and making a plan where she agreed at the end of the call that, you know, there was the opportunity to call the crisis team, there was the opportunity to think about different strategies that she could use, but also there was the opportunity to specifically check in with the worker at a specific time. And that was one of the main things that we always think about when we're working with anyone who is vulnerable in this way. If you say you're going to do something, please make sure that you actually do it. So that was one of the first cases that we talked about in our team that we thought might be useful to share. The second was an older woman, so a woman in her 70s, who had a series of suicidal attempts, quite significant ones. But what hadn't happened, I suppose, with this client until she came into our service was the opportunity to think about what the main driver was behind this particular need to not want to be around. And what we learned from this woman was there was a huge loss of roles. So her husband had died, her children had moved away, she was incredibly isolated and felt a lack of connection. And this is something that we see quite a lot in this particular area of work, where connection is lost and almost needs to be regained through different ways. And what this particular clinician did with this client is start really hooking up with different services and working in partnership with other people, and getting her to be able to identify new life roles and to prepare for a life which looked very different after the loss of her lifetime partner. And that, again, caused her to stabilize a lot more and feel that there was, what Karen was talking about earlier, a sense of hope and a potential future that she wasn't able to access on her own and independently. The third client was probably one of the most harrowing ones that I've offered clinical supervision to staff to deal with. And this was someone who had a very long history of again, suicidality and a very long history of pain and trauma, actually. So she'd had a very difficult early history, and she was with a partner in a very sort of high-risk DV relationship, and had been with this partner for 20 years, and in some ways was almost protecting the partner's abuse of her. And her way, I suppose, of dealing with what this left her with was through self-harming behavior, and ultimately through her plans of committing suicide. of completing suicide or acting on suicidal ideation. So again, what happened in this situation was the member of the team who had to work with her almost had to provide what I would think of as an auxiliary ego strength, because all her sense of why she was here and a great feeling of being a burden to people in the world rather than of adding value needed to be acknowledged and held, but also really worked through in a consistent way. By offering her, I suppose, a very consistent level of contact and support. So what helped was really working at her pace. And her pace was a lot slower than, I suppose, what we would have wanted in terms of reassuring ourselves that we were managing her risk more effectively. Which makes me think very much that when we're working with someone who is actively suicidal, it's really, really important to think about who we are protecting. Are we protecting our organization by going through tick box exercises and making sure that we can document on our various recording systems that we've managed risk and we've come up with a safety plan and we've got things which are in place? Or are we actually really genuinely working to protect the client? And if that's the case, how does that look? I'd like to give a demonstration of how I think that looks by reading out a short vignette, which I think encapsulates a lot of what I hope the network offers for people who are vulnerable. So this is a case of a client who stated that he had given up on life, so he came in as a safeguarding client to our service because of his living conditions and his life history. He stated that he intended to end his life and told us the manner in which he would do it. So he was very clear about his intent and how that he would go about doing that. So this is quite an interesting insight that the clinician shared. He said he moved physically closer to the client and he displayed body language which showed that he was attending to him. We told him that we were sorry to hear that he was feeling overwhelmed, and we knew that it must come from a place of sadness and hurt. He spoke about his childhood, and we validated that what had occurred was not right, and that it would have been difficult to live through this and to forge a successful adult life. With his body language at this point, he showed us that he was receptive and wanted to be reassured. We used some of the objects in his home to prompt discussion to times of his life that had been more positive. And we shifted the focus of our conversation from this very difficult past to the present and then to the future. We made it clear that we were here to support him now and that we would be here for the immediate future. We reviewed some of the people in his life who would be upset if he ended his life and encouraged him to consider himself as helping them by choosing to continue to live. We spoke about the possibility that his future could be different from his past, making sure to discuss this in terms of emotional states rather than physical realities that we could not guarantee. We used the themes he provided in his dialogue to steer discussion towards a future where we knew he had a purpose and where he didn't feel the need to defend himself from everyone and everything. And finally, we allowed him space to process and absorb what we had said and to independently tell us that his feelings of hopelessness had eased. We discussed a primary source of social support for him if he were to be overwhelmed again, and encouraged him to see himself as needing rest and recovery the way he would from a physical injury or illness. We discussed that people recover better when they are helped, and that reaching out is the only way for others to know they can be, that others to know that how they can provide support that is needed. And finally, he agreed that he would do this for himself and for those wanting to help. But I'd like to think that in a nutshell, encapsulates some of the work that we do at the network. And if we look at themes throughout all the 4 cases that we've just very briefly touched on, we have a real sense of needing to feel connected or reconnected with other people, with our community, and sometimes with ourselves. We have to shift very much from the concept of feeling burdens to society to actually feeling maybe needed and relevant. And mainly we have to feel that we're not alone when we reach those points of very, very heightened distress. And what helped with all the cases was a reminder of life roles and a reminder very much, as Karen said, of hope, and giving hope, of identifying and locating hope when our clients don't feel able to do that for themselves. Right, thank you.
Thank you, Michelle. Thank you. Thank you for sharing those stories. I understand we're running a little bit late, so John, should I pass back to you?
Thank you, Karen, and thank you, Michelle. Yeah, we're running a little bit late, as I think there's been so much rich content with the stories that have been sharing, and thank you for sharing all of those stories, Michelle. I think unfortunately we're getting more and more often these complex cases that are coming through, and how we are working together on those. I'd like to mention that the network are the adult safeguarding leads in Barnet. That's an important line for any case discussion, and making sure that we're making the right decisions to safeguard people. Deborah Neville was also another Neville manager at the network. She wasn't here today, but we know that Deborah and Michelle also sit on the early help panel and are involved as part of that. So even though their main focus on adults, they're still involved there. And it's important in terms of getting in quickly to help to work on prevention and support people and young children as well, who can be affected by their different situations. And that leads me on to introduce Jane Abbott, from the Mental Health and Resilient Schools Programme Manager at Public Health Barnet. Jane is going to talk to us about resilience in schools and Papyrus suicide prevention training.
Hi, morning everyone. I just want to say it's been a privilege actually to listen to everyone today. So yeah, I'm Jane Abbott. I run the Resilience Schools Programme, and sorry, just hold on, John. Can everyone hear me okay? Because I've got sort of feedback somewhere. Yeah, so Resilience Schools Programme came about as part of the CAMHS transformation, where it was looked at early intervention and prevention, and that schools are best placed to do some of that work. So next slide, please, John. It's very much based on the Thrive approach, Barnet adopting in many areas the Thrive approach, whereby we are getting help for families but without sort of tiers, because we know, don't we, we've just talked about that continuum of mental health, that we don't just sit in one place. If we have a broken leg, we don't have it for life. And Resilient Schools is that very first quadrant about getting advice, raising awareness, addressing stigma through a whole school approach, including parents, families, the community around them, and we go into the next quadrant when we think about our mental health first aiders in Barnet and our pastoral support forum, where we're sort of working with people and having more of a goal focus. Thanks. So Resilient Schools is a whole school approach, as I've said, and research evidence shows us that if a school works to have strength in all of these areas, these 8 components, that you will have raised resilience throughout the school. As I said, it's including families, pupils, staff. So we've added digital resilience, as it's when we first started, it was a huge emerging concern for us, but also a celebration of how the digital world teaches young people life skills and how they react in terms of their mental health to the less pleasing side of the digital world. Thank you. So these are our components that we offer, and those top 5 are our core components. And if you're a resilient school, we would expect you to complete these core components to be able to have the logo on your letterhead and to say that you have become a resilient school. So the 2 I'm going to talk about is we ask that all resilient schools have a self-harm and suicide document existing within one of their current policies, either their wellbeing or their safeguarding policy. And the key component I feel that Resilient Schools has made such an impact is the youth mental health first aid. So we have trained so far pre-COVID, about 110 practitioners in Barnet are now youth mental health first aiders. Within the school, they raise awareness with staff, they raise awareness through a parent session, and also with the pupils, our targeted pupils, so that everybody has an idea of what mental health is and what it isn't, and feels confident enough to recognise that something may be going on for someone. That really early intervention to know that the person you're sitting next to in the staff room may not just have low mood, it may have sort of progressed further to depression, and then know where to go about it, you know, where to go for help. And then we have additional support, different trainings. Yep, so the youth mental health cover, we've offered 2 days, a 1 day, and we're just training our facilitators to be offer 3-hour mental health awareness so that we can offer webinars. I expect most of you know this. It covers depression, anxiety, suicidal crisis, psychosis, self-harm, and eating disorders. And every one of those is linked back to how that might impact on suicide ideation. And we've spoke about this a lot, but this is one of our key messages to schools and to people on the training, is that we don't just sit static in one place. And I think it's really important for everybody in schools to know that just because a young person has a mental health disorder doesn't mean that they don't have good well-being. So if they're getting the right support, they can have maximum well-being and cope well. I guess the people we see in work with schools, my previous job was safeguarding and working with vulnerable families. I guess the things I saw were people that had no diagnosed mental health, but you could clearly see had poor mental health and minimum well-being. So just to go on to Papyrus, they offer advice, resources and support for any young people under the age of 35 and anyone that is concerned about a young person who they think may be thinking about suicide. They've got a helpline, they've got a lot of resources. Next one. In Barnet, we have, we have 72 people trained across Barnet, and we are commissioning more training in the SPEAK training, which is suicide prevention, explore, ask and keep safe. So it's a 3.5-hour training which spots the sign, you know, helps you spot signs of someone may be suicidal, and look at those barriers of how you're going to support a vulnerable person and where you might go for help and plan for their safety. And should we all be trained? I guess I always come from this place, and I always, wherever opportunity arises, I say the same sort of things, that of course it would be so lovely if we were all trained, and you know, thinking about the Zero Alliance that Sahir was, it looks very possible that we can be, but actually, as somebody has said before, we are just human beings, and if we just had enough confidence to have those human conversations. What I like about that, and I try and show it in places, even though it's fairly old now, I think it just really shows that we just need to have those simple conversations, but also to be aware that, you know, we talked about physical and mental health, how we are feeling mentally on that day, and are we the right person to approach another person that we feel it's in distress. So one of the things I wanted to just say that Resilient Schools commissioned Quell for our staff in Barnet, so it's open to all education staff in Barnet, and that really is about their own resilience. We need to be in a good place to be able to support others, which we all know, and I really believe in those human conversations, just asking, are you okay? And knowing where to go after that. And that's the Samaritans, just to confirm that they're open 24 hours a day, 365 days a year. Thanks.
Thank you, Jane. That's very informative. And just with the video link, I'm sure we can share that to everyone after the meeting. So please do have a look at that short video. I just want to mention I was fortunate enough, as well as one of our navigators as well, to be able to undergo the Papyrus suicide prevention training. It's a very emotive training, and if you have the opportunity, I would definitely recommend that. Jane shared a lot about the sort of wider awareness with the youth mental health workers and the support that's being provided, and there's definitely a drive to increase the awareness of that and what support we can provide. That leads me nicely into to welcome Katie Fulser from the Rethink Mental Illness. You've probably heard of them. They are one of the largest national charities, and Katie's going to talk to us about the Rethink Suicide Prevention and Line and a new support after suicide that they're providing. Thank you, Katie.
Thanks, John. So as John said, my name is Katie Fulser. I'm Head of Community Services for Rethink in the South. Rethink is one of the largest mental health charities in the UK. We deliver over 200 services and 140 support groups, and we were established over 40 years ago. I've come today to talk about the two services that we have that operate within North Central London, and Barnet is one of the boroughs that both services operate within. Currently we have the North Central London Suicide Prevention and Bereavement Helpline that's been up and running, providing support to people across the 5 boroughs since the 22nd of April. And this service will continue to run until middle of October, the 22nd. The helpline was set up kind of during lockdown to give people additional support during what was obviously a very difficult time, and was commissioned partly due to the fact that the support after suicide service that I'm going to talk about shortly was going to be delayed due to that needing to operate and open once lockdown had ended. So the helpline provides confidential and free support to people aged 18 and over who live, work or study in the 5 London boroughs of Camden, Islington, Barnet, Enfield and Haringey. And the helpline provides support to those who are bereaved by suicide, those who are coping with their own suicidal feelings, either in the here and now or in the past, or people who are supporting someone else who is suicidal. We provide support on the helpline by telephone, text message and web chat, so that people can use the medium that they feel most comfortable with to gain the support that they need. We think are proud members of the Helplines Partnership, which is an external body, and we hold an accreditation mark called the Helplines Quality Standard, which means that all the helpline support we deliver is always of a high standard and meets kind of external expectations about what best practice within helplines should look like. So the helpline is open Monday, Wednesday and Friday evenings between 6 and 8 p.m. and Sunday evenings between 6 and 9 p.m. And we have a Facebook page and a website where people can contact us to live chat during our opening hours with a helpline worker. The text messages are charged at people's normal standard rates, so some people will get those free as part of their current mobile package, or they'll be charged at whatever the provider's normal text charge is. And the helpline is free from landlines and mobiles to allow people to be able to access the service at no cost. The helpline can receive texts when it isn't open, and users will receive a message back to let them know that we'll respond to them within our opening hours. And the phone line and web chat function will only connect someone through to a helpline worker when the helpline is open. The helpline provides emotional support, kind of support during periods of crisis. Will help people to talk through coping strategies, think about self-management techniques, do signposting and get people emergency help if they feel they need that during that evening in that moment. I'm unsure if that slide's moved. Could anyone confirm if that's shared and moved? Okay, perfect. So our new service launches on the 12th of October. So we'll launch just after World Mental Health Day. This new service is there to support people who are bereaved by suicide, who live, work or study in the 5 London boroughs, but will also provide support to people who have been affected by a suicide that's happened within the boroughs, but they themselves don't live, work or study within the borough. The service will provide intensive practical and emotional support through one-to-one support sessions, which on average will be between 6 and 12, but can be extended for people if they need longer term support. It will include signposting, providing advocacy and practical help to help people navigate through the difficult and distressing events that happen following bereavement by suicide. When someone finishes using the service, we'll do monthly check-ins every month for 6 months, and we'll also check in again with the person on the anniversary of their bereavement. We'll also provide specialist bereavement support groups that will be closed meetings so that people will join them from the start and work through a series of sessions in the group through to the end, which helps people have trust and confidence in the group and build rapport with the other people that are there. We know that for people who are bereaved, being able to share those painful experiences and hear from others really helps people to cope with the feelings of loss and grief. We will also work to do suicide awareness and prevention activities and take part in events like this locally that are going on to raise awareness and help people understand the reasons why someone might feel suicidal and the types of things that can help people through that crisis. We'll also work with our national groups Rethink team, who support people to set up other independent groups that are peer-led that can be about ongoing emotional support or doing activities or community events with each other as part of a peer process. So we hope that those will spin off in local areas so that people can develop longer term peer emotional support. We are just in the process of producing the new publicity materials for the Support After Suicide service. So if you are interested in knowing more about the service, you can send us an email to this email address and we'll add you to our mailing list. And as soon as the publicity materials, referral forms are ready to go, we will send those out to you. And I'll put these links in the chat for the presentation as well.
Thank you, Katie. That's very helpful. I think we are running slightly behind on time, so I think it'd be good if anyone does have any questions for Katie to put it into the chat, and then we can pick that up afterwards, and Katie will be able to answer. So Rethink, as one of the national charities, is one of the main sort of sources where we would connect people up to in terms of needing suicide prevention support and also counselling services, as well as Katie has mentioned. And I'd like to introduce now Claire Gibson. Claire is our CMHA IAPT clinical lead and also works at the Grenfell Health and Wellbeing Service. And she's a CBT and EMDR therapist. She's not able to join us today, but she has put together a video on suicide prevention and the effects of isolation as a risk factor in suicide, especially now during COVID-19, and that's becoming a larger issue. So hopefully this video will work.
Hello, my name is Claire Gibson and I work as a CBT therapist. I'm here on World Suicide Prevention Day to think in a bit more detail about one of the risk factors for suicide and the ways in which we may be able to prevent it. The risk factor I'd like to reflect on is that of isolation, the feeling or sense of being cut off from others. Due to the pandemic, restrictions were placed on human contact. We were refined to one household, and face-to-face contact with other friends, family members, colleagues, and faith communities was prohibited. Lockdown has now eased, but measures still remain in place which can hinder human contact and connections. For example, masks and social distancing can make it much harder to strike up spontaneous conversation on a bus or in a shop. And also physical touch, a simple hug which can boost the feel-good hormones, now becomes a risk. And for many, their social activities and hobbies have stopped or altered in some way. And with an increase in working from home and also in job losses, many may have lost the connections that work would have brought them. And also, sadly, many may have lost a loved one, again, likely to increase a sense of loneliness and maybe isolation. So with isolation potentially on the rise, what can be done to try and tackle it? especially in the context of the pandemic. For those working in mental health services, it can be important to check and ask your clients about their connections and sense of isolation. Questions such as, do you have others you feel close to and connected with? How often do you see or speak to those people? Does that feel enough for you? Have you still been able to maintain your relationships with others during the pandemic? With more information on how isolated someone feels, we can then better think with them about what interventions might be helpful. For some of us, technology greatly helped fending off feelings of isolation and loneliness during lockdown. But for others who maybe felt they couldn't participate, it actually may have increased their sense of isolation even more, a sense of feeling left out. Those with limited incomes may not have been able to afford the technology, and for others, such as older adults or those with learning disabilities, they may not have had the skills to be able to benefit from the digital world. This doesn't have to be the case. Charities such as Connect the Love and Wavelength help to link vulnerable people with smartphones and tablets. There's many courses to help people to be able to use things such as Zoom and WhatsApp to help build their connections. We can also help clients to access activities that are still running. Most activities have been adapted in some way. A yoga class that once happened in a gym may now be in a park, or the pub quiz is on Zoom. But helping our clients to find meaningful activities that link with their values can increase their sense of connection. Of course, if people are feeling isolated, they may not reach out to mental health services. So we actually may need to reach out to them, to go into the local community, to talk to people, to ask them, what do they need to feel less isolated and more connected right now? And to listen to and learn and work with those who have lived experience of feeling suicidal and isolated. What helped then? When they were feeling disconnected from others, what was that like and what did they need? And as individuals, we can all play a part. We can give our friends, colleagues, relatives a call to find out how they're really doing and make sure we have the time to listen to their answer. We can check in on our neighbours, especially those who we know might not have as many people checking in on them. And we ourselves can also help someone we know to be able to use Zoom or WhatsApp, or give them an old smartphone. It might make the world of difference to the connection they have with others. And just ending with the reminder that not only can strong human bonds bring joy, comfort, and meaning to life, they can also be hugely protective against suicide. Thank you for listening.
Thank you, Laura. So it's great to hear from Claire there and talking about isolation, which is one of the main issues that we feel, especially with COVID-19. I've seen a couple of questions there in the chat as well around how the lockdown is affecting everyone. And I think it's nice then to introduce Professor Catherine Loveday. Catherine is the Professor of Neuropsychology from University of Westminster. She's a trustee at AGK, and she'll be talking about looking after ourselves and others through kindness, and that will go a long way to tackling isolation. Kathleen's appeared on Radio 4's All in Time Mind, BBC radio and TV programmes, and is also author of The Secret World of the Brain as well. So over to Professor Kathleen.
So I wanted to talk very generally just for a few minutes about the kind of evidence-based ways that we can both look after ourselves and be kind to ourselves, but also how we can be kind to other people, and how being kind to other people actually ends up being kind to ourselves. So I think a lot of the kinds of things I'm going to talk about have already been mentioned in the various presentations today. But I guess I wanted to divide it into two halves. One is the things that we do for ourselves, and some of that is about building resilience that we've heard is important. A lot of this is about prevention and trying to reduce the chances of developing severe depression. And I guess also some of these things are things that will reduce depression in people that already have them. So some of these are really basic actually, and they're things that we often take for granted. So keeping our stress levels down can be very, very hard at times, but it's something that really makes a huge difference. And we know that extended stress leads to depression. So anything that you can do to reduce that stress is going to be important. And as John mentioned, I'm a trustee of Age UK Barnet, and there are various services there that will help with very, very practical things like money problems and getting food, and some of the really, really practical things that might be kind of increasing stress. Also, the things that we tend to put ourselves second a lot of the time, and things like rest and sleep and exercise are often the things that we leave behind when we're worrying about lots of other things and worrying about other people and trying to meet lots of commitments. So one of the things that has been shown from the evidence is that it's actually really, really important not to leave those behind, and actually taking even 15-minute rest break, where you could do anything from going out and pulling some weeds up to listening to some music or reading a book or having a chat with somebody. That sort of 15-minute break in your life always feels like it's an indulgence, but in fact it pays huge dividends. And a small rest break like that can make us much more able to engage effectively with what we need to do, and that in itself then ends up lowering our stress level and making us feel better. And also nutrition sounds really, really basic again, but actually regular healthy meals is hugely important to our brain and does help to it's a way of nurturing ourselves, but it's also a very physical way of making us more likely to have to be mentally healthy as well as physically healthy. And again, that's something that Age UK Barnet can help with. All of these things, exercise as well, regular exercise, again, very, very strong evidence-based that sort of makes a huge difference, just getting out for a walk, especially in green space. And I know that that's not always possible for people, but anything at all that kind of gets you moving is going to make a difference. So although these all sound like fairly trivial, practical things, if you can build them into your life or help others to build them into their lives, the evidence suggests that it makes a really, really big difference. But I also wanted to talk about not just being kind to ourselves. I guess the other thing is we also have to be compassionate to ourselves and recognize that sometimes it's okay to not feel okay, and that we should, in those cases, accept that and recognize that we feel like that, and allow ourselves to sit with that and to look for the support outside. And then the final thing I wanted to talk about is how being kind to others actually is also being kind to ourselves. And I just wanted to tell you about a big survey that was done with nearly 5,000 UK adults. And they found that 63% agreed that when people were kind to them, it had a really, really specific and positive impact on their mental health. But what was interesting is they found the same proportion of people agreed that it had a positive impact on their own mental health. So being kind to other people also has a positive impact on us and ends up affecting our own mental well-being and our own mental health. And I think it's really important, as has already been said, to recognize that these don't have to be grand gestures, and they can be within our remit. So it can be all of the following things have been shown to make us feel better and happier. Giving a small donation, even a small few pounds donation to a charity that really means something to you, smiling at somebody, listening, so learning to just listen to what somebody has to say, and just the small talk, as was shown in the video earlier on. And I think we can do those to people we know. We can have those small acts of kindness to people we know. We can also make small acts of kindness to people we don't know. And I think in today's divided society, it's particularly important to make those acts of kindness to people that are different to us, because there is a lot of division, and that division is stressful and uncomfortable and isolating. So anything we can do to break down those divisions by making an act of kindness to somebody that maybe is a bit different to us and not within our immediate group is going to be even more helpful. So I just wanted to finish with a couple of very practical suggestions. One is that gratitude, showing gratitude and recognizing what we have, even when we may not have a lot, has a huge evidence base in terms of making us feel happier. And there's a task called the 3 Good Things task, where at the end of every day, you just make a note of the 3 good things that have happened today, or 3 good things in your life today. And there's really strong evidence that if you can do that every day, you then start looking for those things, and expressing that gratitude seems to be really helpful. And the other thing that you might want to try or look up is loving kindness meditation, which is about sitting and thinking, just meditating on a positive and kind thought to somebody else or to yourself. So very quick whiz through some of the evidence-based things, but I hope that people will find that helpful.
Thank you, Catherine. That was really helpful and really informative as well. I know it's only a very short slot to share some practical ways how people can share their kindness and compassion with others. I think one of them was around sort of listening, which is always really important, to listen to the person who is going through those experiences. And that leads me on to the next speakers, Oscar Myant from Mind in Barnet, and also Rory Cooper from Community Barnet. And this is about us in terms of as a borough listening to actually what's happening with COVID-19. Unfortunately, a lot of people have been bereaved by the situation, and there's a new service that Oscar and Rory will be sharing with us. So over to Oscar and Rory.
Lovely. Hello. Good morning, everyone. Thank you, John, and thank you everyone so far for what's been a really interesting session. So my name is Rory. I'm the head of health and social care at Community Barnet, and I'm joined by Oscar, who's the project lead for the bereavement service at Mind in Barnet. And I'll be very pleased to tell you about the service and how it can support our residents and clients who have been bereaved this year. So I'll start with a brief overview of the service and some of the support that Community Barnet is offering before I hand over to Oscar, who will give a bit more detail on the Mind in Barnet offer, particularly around emotional support and counselling. So the Barnet COVID-19 bereavement and counselling service has been commissioned by Barnet Public Health to offer a bereavement and counselling service to Barnet residents who have been bereaved during the COVID-19 pandemic. And the service is jointly offered by Community Barnet and Mind in Barnet, although we fulfil specific roles. Barnet, like every part of the country, has been badly affected by COVID-19. There have been 458 COVID-related deaths in the borough up to 21st of August. And so not only has the pandemic created excess deaths, it has prevented bereaved residents from having the opportunity to mourn and grieve for their loved ones, both informally and in terms of traditional ceremonies and traditions. So lockdown is creating barriers and more difficult circumstances for us all. And this interruption in the rituals of mourning and grief continues, and it is understood that this could lead to mental health concerns and problems now and ongoing in the future. Individuals who are bereaved during this time, as well as having the pain of unexpected deaths, have the impact of social distancing, which prevents people from coming together to mourn and commemorate. We have the limitations on funeral attendances, changes to traditional ceremonial processes, and you know, the fact that people are having to grieve in isolation much more than they otherwise would. And so the service seeks to address these extra practical and emotional pressures. The service is eligible for anyone who lives, works or studies in Barnet and who has lost anyone this year, regardless of whether the death was COVID related or not. There's an understanding that lockdown presents these challenges to all of us, however we lost someone. And so the service will support anyone who's had a bereavement this year in 2020. We've been running the service since June this year, and it's initially been commissioned until December with a possible extension beyond that. So what the service offers is a sort of very rich and immediate offer of support and complements and adds to the existing bereavement support that's available locally. In terms of accessing the service, the people can ring up between 10 and 2 Monday to Friday and speak to someone, and people can send in referrals anytime they would like, and we accept referrals from professionals and from members of the public directly. All of this information is on the Community Barnet website, and we'll share that after the event as well. And we've been pushing, there's lots of information about this on our various social media and on Barnet Council social media as well. And there's a new animation that's just been made about the service, which gives a lovely sort of summary in quite an engaging way about how the service works as well. So have a look out for that. So Community Barnet's main functions for the service, beyond being the contract holder, are to offer the front door of the service really, and some initial practical support and information for clients before. They also have the opportunity to get emotional support soon after. So our staff are the first port of call for any queries or referrals, and anyone who does make contact out of after 2 o'clock can expect a response within 24 hours, probably much quicker than that. Now the line is run through the number that we originally created for the COVID response service that we ran for younger adults from April to August. And when clients, when bereavement clients got in touch during that period, they were able to access some of that practical COVID response support. But now it's a case of we're act as the first point of call for residents seeking support and being able to respond to them promptly, and we'll lay out the process and the pathway for clients about what's going to happen and how quickly they can expect to hear back, which is very soon. We just want to make sure we've got all the information we need necessary for them, so that all that sort of administrative stuff and the other practical support we can offer is done. And once they're with Mind in Barnet, they can concentrate on getting the sort of emotional support they need. We've got a very big information and signposting pack that we send out, which sort of brings together lots of information around bereavement, about, and particularly about some of the support that is available at the minute during the sort of variations of pandemic and lockdown. It's still very difficult to have full ceremonies and traditional arrangements. So things like what to do when someone dies, self-care tips, emotional support, and a much wider directory of services about the kind of practical elements that you may or may not need when you sadly lose someone. And beyond that, we're there to offer practical support, and really, so there are often services that person might benefit from that aren't bereavement specific, and we can also sort of help signpost them with that, give them information that any Barnet resident could benefit from. And it's our opportunity then just to sort of see what else that person might need. So once we've got all that information, we're clear that we've given them as much information as they possibly need. We're there for the rest of that client's journey with the service if they want to come back and they want to check with us about anything else at all. But beyond that, we then pass on to Mind in Barnet, who will get in touch with them soon after. And I will hand over to Oscar, who will take us through that part of the service.
Yeah, it's been really interesting listening this morning to everyone's presentations, and it's very promising to hear what people have to say, because it really, I think, parallels what this service is about. You know, what I heard from earlier presentations is the importance of early intervention and prevention, having a person-centered approach, and also it being collaborative. And I think these three pillars are what this service is about. It is about early intervention and prevention. It's about making sure it's very user-friendly, and you know, it's a very dynamic service that's been driven by what the community needs, and it's very collaborative. We work with GPs, we're working with schools, universities, care home, religious organisations to kind of put this service together. So, you know, I really would encourage anyone who has been affected to come forward and to reach out to the service. As Rory says, unfortunately, you know, we have, you know, this borough has been impacted by bereavement and COVID-19 bereavement. And there've been a lot of additional factors that all affect someone's mental health, which includes not being able to say goodbye, grieving in isolation, not having the rituals perhaps that are kind of there to be able to support individuals. As Rory has mentioned, you know, this project is for the community. It's for people who live, work, study in this borough. And one thing that's really been promising is that it's run by volunteers. You know, the spirit of the community has been absolutely incredible. We have trained, qualified counsellors, you know, who are here, who do want to support. So even though we're going through something very tragic at the moment, you know, that the community have really come together during this unprecedented time to offer their support. And not only, you know, have we had support from Cruse Bereavement, so our counsellors have been trained by Cruse. They've also, a lot of them have worked for the Samaritans in the past, and, you know, have had training in terms of being able to deliver this service via telephone, but also electronically through WhatsApp, through Skype, through Zoom as well. One thing I want to stress, you know, so I'm going to talk now about the feedback that we've had from the service users. And one thing I want to stress is how amazing it is in terms of the responsiveness of the service. So what I mean by that is anyone who gets in contact will have the opportunity to be able to speak to a counsellor within one working day. You know, this is quite exceptional. As many of our service users who have had mental health support have been really surprised that actually they are able to speak to someone so soon. So that is perhaps, you know, what's so unique about this service offering is the idea that they can have early intervention almost immediately. What we also provide is we will do a risk assessment almost immediately in terms of looking at suicidal ideation and kind of how perhaps high risk or low risk they may be of harm. And then they will also have the opportunity to see bereavement counselling. So in total, service users will be able to get 12 sessions. One thing I want to also stress in terms of what is so wonderful about this project, that it is very diverse in terms of the service users. So in terms of the BAME community, we have over 72% of our clients are from the BAME community. 37, nearly 40% of the service users are men, which is really kind of encouraging to see. And 50% of our service users are from the age range of 45 plus. The people who have used our services have had quite high recovery rates. So what I mean by that is, you know, I do touch base with the clients who use our service, and they are, you know, really, really thrilled to be able to have the support, but also be able to kind of go back to kind of functioning, everyday functioning. So what I mean by that is just to be able to leave a house, be able to kind of reach out to their support network, etc. So yeah, so in terms of the service overall, I would just encourage everyone to really kind of go to the Community Barnet website if they want to make a referral. Feel free to leave a message via chat if they want any more information. And thank you for your time.
Thank you, Oscar, and thank you, Rory. That was very informative and helpful. We do work very closely together as part of that partnership. And as Oscar said, people can refer themselves directly into the service, or they can come through other partners such as the Barnet Wellbeing Hub, and then have that conversation with one of our navigators to then be connected onto that service. So I'm going to talk a bit about, in terms of the Barnet Wellbeing Hub, and also the benefits of working together to prevent suicide as part of our joint case management work. So first of all, hopefully everyone has heard about the Barnet Wellbeing Hub, but just as a brief outline, what we are is a rapid access, high volume social prescribing connecting service. And similarly, we try to provide that access into our service at the right time when people need it. So there's a very short, if any, waiting list to actually speak to someone. Now we also have that person-centered collaborative approach, and we a lot of our work will function around our what we call our emotional health check, that Sarah Perrin did mention earlier on today. And what that is where one of our navigators will have an appointment, something that's comfortable, whether it's by telephone or could even be by email or face-to-face before the lockdown, where they would listen and help the individual to then identify different goals and work towards a tailored well-being plan. Now, often, especially now with the lockdown, more and more people coming forward with more complex issues. Since for over 2 years now, we've been working together with our partners. That's at to run what we call a joint case management meeting. So that's a multidisciplinary team case discussion about cases to try to make to do our best to, one, keep people safe and manage their risk, and also to come up with a coherent outcome and plan to support that individual the best we can, based on the knowledge that we have shared across the team. So within that meeting, there is the network. You heard from Michelle Moraes earlier today. A member of the network, whether it's Michelle or Deborah, does join the meeting regularly. Also, we have one of the service managers from the IAP service, which is the Improving Access to Psychological Therapies, who has their input as well. Also from the GP Link Working Team. GP Link Working Team are the sort of bridge between primary care and secondary care. So they can deliver psychological assessments to determine if people are suitable and what secondary care services are most suitable for them. It's also attended by Barnet MenCap, who provide services for people experiencing autism and a learning disability, and provide that specialist support there. And as was mentioned earlier, autism is unfortunately one of the areas where there's a higher prevalence of suicide. So within those team discussions, we then formulate a better idea and background of the individual to make sure that we're not repeating the same services or connecting them to somewhere they've already been before. And perhaps it may have worked on some areas, but hasn't covered everything. But through that joint work, we are then able to identify the better path for them and connect them up with the most appropriate service that suits their needs. So I want to just give a quick example of one of the cases that has accessed our service before and went through the joint case management meeting process, and to talk a bit about her story. So this lady, unfortunately, she was suffering from domestic violence at the time. And in her past, she had suffered a lot of sexual abuse as a child from family members. She felt everyone was blaming her for how she looked, how she was, how she behaved, and she felt ugly, which was very strange. It was very no, that was far from what she was, but she had lacked that confidence. She didn't have that belief in herself. No one had listened to her. She didn't feel that she could speak to anyone. Whenever she tried to, everyone dismissed her previously. So she had contemplated suicide, and no one ever really talked about it seriously. They said that she was young, that she had a lot to look forward to, and to get over it. She had tried to talk to some professionals before, but she never was able to share her full history, because she didn't have that confidence to share. She didn't believe that people would talk to her. She had a breakdown. and did have suicidal thoughts, but fortunately, one of her friends connected her with the Barnet Wellbeing Hub, where she had an appointment with one of our navigators. So through the emotional health check, we were able to listen to her, and she was able to share her story, and she gradually felt comfortable in sharing what she was going through, and talking a lot more about her history, that even her GP, she hadn't shared the full story to them. So through that, we brought it to the joint case management meeting. It was discussed within the group, and first of all, to identify if there's any safeguarding and risks there. So we got the information from when she had called the crisis team, and other interventions as well, and what she has tried before. So what we did was connect her up with various different services in order to build up her confidence and build up her resilience. So one of them was around our wellbeing workshops, which is part of the IAT outreach program. We provide regular workshops on building confidence, on managing depression and anxiety, stress, and so on. She also attended the International Women's Day event, which is based on body image and how we were celebrating sort of women and an empowering event, and where we shouldn't feel any shame with the body or managing the expectations that society has and put on women. So she gained confidence from that. And from then, having isolated herself quite often, she then started to take part in more social activities. And one of her long-term goals was actually to join the course to help her towards her future and to build something, and something that she was interested in, always had a passion for, but was always shot down. So she has, we're pleased to say, she joined that course. And I think, as Michelle mentioned before, as part of our work, we're looking at short-term, also longer-term interventions, and she's built up that sense of hope for what she can do. In terms of how she actually found out about our service, it was partly her friend, but it was also actually picked up by the police as well, who then connected her up with our service. And so it's about that collaborative work we have, and with in terms of the Wellbeing Hub, what is that? The Wellbeing Hub is about the collaborative work between everyone and every single service across Barnet, and we work towards connecting up to people. There's a lot out there. We've connected people up to over 350 services so far. As Sarah mentioned before, there's over 1,000 different third sector organisations alone in Barnet. So there's a lot more still that we can do to connect people up. And that is about the sharing of information, sharing of and collaborative work, and really identifying who is involved and can support people, especially to prevent suicide. So that leads me on to our next speakers from the Metropolitan Police. We're joined today, I know Steve Keane is here, and I think Carl as well, but we're actually joined by, I think, Peter Frost, who's going to talk about the role of the police in preventing suicides and a growing challenge in facing off.
Yeah, good morning, thank you. Thank you for having me. So yeah, my name is Pete Frost. I'm a police officer with the Met, and I am the suicide prevention officer for the Met. The role is fairly new, in fact so new that I don't actually go live officially until the end of the month, but I have been working within suicide prevention within the Met in what spare time I have for the last sort of 2 or 3 years. So I just want to speak to you quickly about really the role of the police within suicide prevention. So I think it's fair to say that we're not the primary service for suicide prevention, but we do have an integral role to play. And a lot of that comes from the data and information that we can provide to other agencies. So for example, we as the Met will attend roughly about 7,000 sudden deaths a year. Sudden death is anybody who dies unexpectedly outside the home. Of that, we'll attend between 90 to 95% of all suicides within the Greater London area, which is roughly around about 550 to 600. Put that into perspective on a national picture, I know that a lot of people look at it per population, but the Greater London area accounts for about 10% of all suicides that happen across England. So we have a huge volume of data and information that we can then pass on to support agencies and prevention charities and so on and so forth. So some work that's been going on recently, in fact, as the things, the first week into lockdown, us alongside the Mayor's Office, some elements of the NHS and an organisation called Thrive London launched a real-time suicide surveillance system, which is a real-time data system. It's the largest one that we know of anywhere in the world, definitely the largest one in Northern Europe. And what that allows us to do is have an up-to-date picture of suicidal occurrences across London. This allows us to locate high-risk locations, identify those, and to identify any sort of contagions or sudden spikes. And certainly we were in touch with Public Health England all the way through the most severe times of lockdown, dispelling rumours and myths that certain areas of London were seeing huge increases in suicides and so on and so forth. So we were able to get out some accurate data and some accurate information in there. And I suppose that's really where the role of the police comes in, is that data sharing off to prevention so we can have everything as an evidence base. Now, of course, the role of the police, the primary role of the police is to save life. So when people are reported missing and there's a risk that they may be missing because they want to kill themselves, then rightfully we'll take on that investigation and do everything that we can to find them. But by analysing the data that we're now collecting, we can do that a bit smarter and hopefully find these people before they go on to die. So for example, just some data I was looking at yesterday found that over half of all people who die outside their home address are found within 1 mile of their home address. So we'll be saying to frontline officers over the next few weeks, look, if you are at the scene of a high-risk missing person who you think has suicidal ideation, search within a mile. Get everyone out there within that mile boundary, and then let's see if we can find them first. And that's just an example of how hopefully some of the data will help us to prevent some suicides. The real-time suicide surveillance system then has 2 aims already mentioned. One, the identification of high-risk locations and contagions and spikes, but also it allows us to provide bereavement support very, very quickly. So what happens is, across all of the working areas of the Met, the 13 we call them borough command units, they're essentially 3 boroughs that join as one. You have a single point of contact for suicide prevention there. They input the data once they've identified a suspected suicide onto the real-time suicide surveillance system. And then the local authority, the NHS, can go in and access that data and contact next of kin or witnesses or people they feel need bereavement support. So it can happen very, very quickly, which of course I know I'm probably preaching to the choir, is super important given that we know that people who are bereaved are much more likely to die by suicide themselves. Some difficulties we have then, most people never come to the attention of the police. Trying to get through the stigma of why the police are at the scene of a suicide as well can often be a challenge, and these are things that we're working on training with frontline officers so that they can overcome those. The vast majority of people who die by suicide do so in the home address. Again, no contact with the police and things, but at least we can provide that data to the health services long before any kind of coronial inquest. And I think that's the key here. You don't have to wait 11, 12, 13 months for that up-to-date data and information, but we can pass over relevant information, and then that can help to inform suicide prevention strategies. So that was pretty much everything I had on the role of the police. Sorry I didn't have any slides with loads of data and things. But yeah, any questions, please pass them through and I'll do my best to answer them.
Thank you, Peter, and thank you so much for joining us today to share about the role of the police. I think we've all been working collaboratively together to better inform the police when we do sense there's a very critical kind of issue and that risk. And we've really seen the response from the police with the training that's been going through for their frontline staff, as you mentioned. And that's been really helpful to really manage those situations sensitively, and hopefully that will go a long way to preventing suicides and other issues around risk as well. So thank you very much.
John, could I ask if Julie George is around? Maybe she could just set a bit of the scene whilst we're just waiting for the technology to catch up.
Yeah, I can. I'm here. I can talk.
Thank you.
I'm waiting to be. It's a bit like what's the film? I'm thinking of the yellow brick road. I'm waiting to be whisked out of Kansas into into Oz. Anyway, so the next session is actually an opportunity for everyone who's been, listening carefully to the presentations to actually get a chance to have their say. I mean, there's been a lot of activity in the chat, which is great. But this is a chance to kind of talk about what you think the priorities should be, having heard all the different presentations, because we will use this to start to formulate our suicide prevention strategy for Barnet, which we will align with the North Central London suicide prevention strategy, which is also being developed. But we need to work out what's right for local people, as well as sharing in the resources that come with working across a wider sector. We have given some suggestions for the sorts of things that you might want to consider. So, for example, we know that suicide is higher in men and in certain groups, and it's worth thinking about, do our services actually, do they meet the needs of those particular groups? It's probably worth thinking about, are there gaps in services? So is there some area where if we put in an additional service, it could make a real difference? And I think there's also thinking about populations where we don't necessarily know there's a higher rate of suicide, but might potentially be underserved, or may have suffered differentially under COVID. For example, people from Black, Asian and other ethnic groups were particularly hard hit by COVID. So do our services or our approach, is it suitable for all sectors of our community? So those are just some ways in thinking of people to start the conversation going. What we want is, we don't have a lot of time, but what we would like is for every group to come back with 2 priorities. So what are the 2 things that you think, if we did that over the next year, would make a difference on top of all the other things that other people are doing? And it might be something very, very small, or it might be something quite big, but we want 2 priorities out of each group. So I think that's the brief. And haven't yet been whisked off to to Oz just yet, but I'm sure it'll happen any minute now. Anyway, I'm happy to take questions if anyone's not sure about what we're supposed to be doing. So.
Yes. Hi, thank you so much for your talk earlier today. Could you just share a little bit, whilst we're just waiting for the technology to catch up with ourselves, could you just share some of the priorities that maybe other areas have included in their suicide prevention strategy? Because I think this is quite a new way for us to think in Barnet.
Well, some of the things that we're doing at a sector level is what other peoples have found important. So it's the post-suicide, support to try and make sure, because there's good evidence that people who've suffered a loss may then themselves are at risk of committing suicide. So actually getting really, really good support in for those people in the early days, but also going on into the future. And Rethink was on the call, and I'm sure told you about that, but just, like recognizing anniversaries or other things that might be trigger points, that can make a real difference. I think what other areas, and certainly what NHS England recommend, is taking, I think, what you like as a quality improvement approach, and that's certainly the way in which the people are maybe quite familiar with the Henry Ford health organization in Detroit that managed to bring suicides down to 0 in people who are known to their health system. And the way they did that is they just iteratively improved small things. So they looked at what was behind any particular suicide or any patterns, and they said, right, well, if we had done this slightly different in this situation, and then they iteratively changed their services. So I think taking a quality improvement approach to just understanding, unfortunately, if we have any, what happened there, could we just shift our services a little? So rather than necessarily making massive change, it was that approach and adapting on a very agile way, I think is how in Detroit, they managed to bring the numbers down. Now, they weren't looking at the whole population. They were looking at people who are in contact with services, but that's still a way of thinking that I think is something worth us exploring. I don't know if that helps, Julie. I'm sure others have more, have been working in this field for longer than I have and will have things to add.
Have you all had and enjoyed the workshop session, had a good opportunity to discuss the various topics there and what you felt was the most important priorities for us to consider collectively in order to prevent suicide? I'm going to pass back to Julie, Dr. Julie George again, who was facilitating the group that I was in, perhaps, and then give opportunity for the other groups to sort of feedback on what they feel were the different priorities that are important. So I can pass back to Dr. Julie George now. Thank you.
Sorry. There are too many buttons to push. Apologies. Thank you very much, John. We had a really interesting conversation in our group. Not everyone was able to speak, but a number of people were contributed. And I think there were a couple of 2 to 3 kind of key points that came out. One was the importance of co-designing services with different groups. In our group, there was a focus on people with autism, that actually the way in which some crisis services are offered just are not accessible because of they're not taking account of neuroatypical or neurodivergent needs at that point. And so they need to be co-designed so that they actually are accessible during crisis, but also thinking about some of the services we offer around prevention, like developing resilience in schools. Is any of that particularly focused on young people that might have autism, because there might be different issues there that need to be addressed? And thinking about if we're currently as a council developing an autism strategy, where does suicide prevention fit in there? Because that's an important, that cross-cutting issue. So there's something about making sure that we address the needs of different parts of the communities, and I'm sure other people may have focused on different parts of the community. I think the second thing was the importance of actually mapping what we already have and making sure everyone's aware of what's on offer, because it's a very rich tapestry, but it is maybe not a tapestry, maybe slightly more like a patchwork quilt. There are pieces here and there, and even those who have been working in the field and doing things like Jane mentioned, doing a mental health first aid, she didn't always know everything that was available. So if she had a ready resource, then that would help with signposting, but also that mapping helps us identify where there might be some gaps. And we can use that to then publicize what is on offer in perhaps places that we don't typically reach out to, like workplaces. So I think those were the kind of things that were coming out of the workshop. I'm not sure that's quite 2 priorities, but I wanted to give some of the richness of the conversation. So it was a really interesting and helpful conversation. So, and I've made some notes, and I'm sure others have as well. So I'll turn over to the next person. Am I supposed to nominate someone, or are you going to do that, John?
Thank you, Julie. I can help with that. So thanks for that. If I can pass over to, I think, Julie Powell, who is facilitating another one of the sessions, and then it will be passing to Sahar.
Okay. So really thank you, John, and thank you, Julie G. Really interesting conversation in our workshop. We did actually manage to get everyone to speak bar one person, which was good. One of the things that people talked about was connectivity and social isolation being 2 sides of the same coin. So it's really important that the strategy does look at acknowledging what does that mean. And so I think the mapping of services that's been suggested, I think will be really helpful. We also, some of the group were also quite concerned about young people, children and young people, not making sure they're remembered, because even though young people always look very connected, they're actually quite often emotionally isolated. And so we need to be able to find ways of ensuring that they don't feel alone and that they're able to form rich relationships. And then there was a third bit, which was around just trying to think about how that suicide prevention can't be a standalone piece of strategy. It's got to align to a much broader well-being mental health support framework, because really part of it is about destigmatizing suicide and being able to talk about it. And you know, and I think the videos that were shown about just that small act can actually interrupt thoughts was really powerful. So I think Rory's taken lots of notes of our workshop. So what we'll do is we'll write them up and send them to you, Suhair, if that's okay. Thank you.
So, shall I just go ahead, John? Very similar discussions in our group. And thank you for all participants. Autism we have also discussed, and I don't want to repeat everything was said earlier on, but what was important for me to hear is that people with autism, they don't talk on the phone, so therefore maybe in terms of accessing services, maybe a webcam is a better means for working with people with autism. So this is probably for a rethink to consider going forward. And training staff, the training overall, training to staff about suicide prevention, training to members of public was very, very high in our group. Connectivity, again, we've talked about that, and also talked about wider well-being, you know, having good jobs, good houses. So these things are very, very important. Maintaining good mental health and well-being are all very linked to preventing suicide. We discussed the gaps as well with regards to certain group, and we talked a lot about stigma and you know, people who bereaved by suicide, they can't even bereave due to stigma attached to suicide in some communities, and they're not coming forward and ask help. So how are we going to adjust our messages to actually work with these communities and try to break some of those barriers? I think this is a very important task going forward. Student groups are also very much at risk groups. We had a representation from Middlesex University, and then they wonderful ideas about videos, podcasting, and so on, about introducing services to people. We have to do these things regularly, short, sharp videos, information, making it available to people. And finally, it is very difficult to try to recognize the signs of suicidal thoughts and suicidal behavior. The only way to do that is by going through training and taking the responsibility. So thanks for all our contributors in my session.
Hello, I wasn't sure someone was going to introduce me, but anyway, whatever. Thank you very, very much indeed for asking me to finish the session. I haven't heard all of it, but what I have heard is extremely interesting. I have personally I was just explaining the last session, actually had somebody I know did commit suicide, and what was so interesting was no one really could pick up the signs, and I think that's what's so sad. She was only 23 at the time, and she actually wrote a note to several people saying to them, you know, I don't know if people even have the time to come to my funeral. And in fact, if only she'd seen when they had memorial service, the hall was packed with people that cared so much about her. And it's things like that that if only she knew. It's something that I've always thought it was very sad. And it's a very complicated issue. And I know recently we had, I think a few years ago in Barnet, there was some very sad reason. There were about 3 children who actually in one little area decided to all commit suicide. So this is such a complicated area, and it's so good to have had a session like we've had this morning. And particularly with COVID, and I think that's another area which is actually very, very difficult at the moment, because so many people, particularly elderly people who've been shielding, are literally not seeing people, and they're quietly suffering on their own. And we're very short for time, and so I would just like to ask, in summing up, if I could encourage people, there's a few things. Firstly, if you could pledge to spend 20 minutes doing the Zero Suicide Alliance training. for organisations to join the Suicide Prevention Partnership. And also there is a support after suicide service which starts in October around the World Mental Health Day. The next hub connections will mark the Mental Health Day event, and that's going to take place on the 8th of October between 10 and 1, again via Zoom, and the details I know will be following. But just to sum it up, thank everyone so much for their time. I think it's been very worthwhile, and hopefully all the things that everyone has said, I know lots of notes, and I know Julie's very good at taking notes, that will be actually followed up. So thank you very much indeed.
Thank you so much, Caroline Stock, and encouraging us to make a pledge. You know, I'm going to make sure that I do one of the training packages on offer by the Zero Suicide Alliance. They have a new training package which relates to sort of social isolation with COVID, which I think is well worth considering, and it won't, you know, it won't take a lot of time. I think it's helpful if everyone, I mean, I know everyone on this call is committed to this topic, but it's worth thinking about what additionally can we do. Just quickly about next steps before we sign off the call. We're going to take away the information we've got from this, from the workshops and also the speakers, and start to pull together some of the early steps around developing a suicide prevention strategy for Barnet. I'm sure we'll be in touch with you, and I'm sure there'll be further events where we try and co-design that strategy, never mind the services. So we'll be contacting you again, but I'm just very grateful that everyone's made so much time today to mark this day and to contribute to our thinking going forward. All right, thank you.
Thank you, Julie. I think it's been a fantastic day to really hear from everyone to share their perspectives. I just wanted to finish off just by thanking everyone for taking part in all of this and really listening to everyone. I think it's a really meaningful, really important issue. I think Dr. Julie George has really wanted to put forward with this whole event. To continue to thank you to Seher for helping to guide us through this, to help us all put this all together. Thank you to all the speakers as well, who's been really informative. He has really enabled that space for us to actually think about suicide. Thank you to Councillor Stock for joining us and the whole event and really talking about how important all of these things are. And lastly, you may not have seen them today, but also thank you to Community Barnet. There's Steph, Ilpa, Rory, Laura, Tola, and I think many others as well, who've helped to put this all together and make it run as smooth as we can. So thank you everyone for joining us. Really hope you enjoyed it. And there's lots of useful resources there that we'll be sharing out with everyone. As Councillor Scott mentioned, there is the World Mental Health Day coming in Thursday, the 8th of October, which will be running, and it will carry on with the different themes that we've had today as well around suicide prevention to make sure that it's possible. So thank you everyone, and I hope you have a good rest.